I'm Joe Graydon.
And I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com. 2/3 of American households include animal members along with humans. Why is this bond so powerful? This is the People's Pharmacy with Terry and Joe Graydon.
Dogs and cats are beloved, but people also have close relationships with horses, rabbits, birds, and many other species. How do you relate to the animals in your life?
Dr. Chuck Miller is the People's Pharmacy veterinarian. He's standing by to answer your questions about pet health and hear your stories.
How do animals enhance your life? Our lines are open for your stories at 888-472-3366.
Coming up on the People's Pharmacy, transforming relationships between humans and animals.
In the People's Pharmacy Health Headlines, a new variant of COVID is taking hold around the world and in the U.S. If you start to feel bad, how will you know if it's a summer cold or the new COVID? Rates of infection have been low, but they're starting to rise here just as they already have in Europe. The new variant NB.1.8.1 has been nicknamed Nimbus. In China, Southeast Asia, and in Europe, many people complain that it gave them razor blade throat. This extraordinarily sore throat makes it painful to swallow. Other common symptoms of COVID, such as fatigue, fever, cough, and congestion, may accompany the sore throat. Symptoms alone can't really distinguish COVID from a different type of infection, though. As a result, if you feel bad, you should definitely test. And if you have COVID, you should isolate yourself as well as you can so you don't pass it on to vulnerable individuals, such as babies, elders, or the immune-compromised.
GLP obesity drugs like Wegovy and Zepbound advertise impressive weight loss in TV commercials. People in these ads boast that they've lost anywhere from 35 to 48 pounds. They add that other people have lost even more weight, up to 58 pounds. That sounds impressive, but a new study published in the journal Obesity suggests that real-world results may be less remarkable. The researchers tracked medical records of nearly 8,000 people who had gotten prescriptions for either Wegovy or Zepbound between 2021 and 2023. Over the course of a year, people had lost an average of about 9% of their body weight. That was lower than the outcomes reported in the clinical trials sponsored by the drug companies. The researchers reported that one of the reasons was likely that in the real-world setting, many people discontinued the drugs, some within a few months of starting. In this study, 20% of patients dropped the injections early. Another 32% dropped out after 3 months, but before a year was up. Not surprisingly, people who stopped using the drugs lost less weight than those who continued. In addition, patients using lower doses of the medications also shed fewer pounds.
Antidepressant medications often take several weeks to provide a therapeutic benefit. A new study suggests that some people may be able to get lasting relief from severe depression with a single dose of psilocybin, the hallucinogen in magic mushrooms. The trial was small, just 30 patients with cancer and depression, but the follow-up period was long at 2 years. There was no control group. The volunteers started with 4 weekly psychotherapy sessions, then had a single 6-hour session during which they took 25 milligrams of psilocybin in a supportive environment. After that, they had 4 more psychotherapy sessions a week apart. At that point, 80% of the patients were significantly less depressed. After 2 years, 50% still had significant reduction in depression. 25% of these participants had had no further treatment for their depression. The author suggests psilocybin may eventually offer an alternative to antidepressants for some people with cancer.
Chronic low back pain is common and hard to treat. It can make it difficult to work or enjoy normal life activities. In a survey, over 60 million Americans reported a recent episode of back pain. Approximately 16 million complain of chronic back pain, which is a leading reason people miss work. A new study suggests a simple intervention could reduce the risk. The researchers studied more than 30,000 Norwegian adults who agreed to wear motion sensing devices. Compared to people walking 78 minutes a day or less, those who walked at least 100 minutes a day were 23% less likely to develop chronic low back pain over a minimum 2-year follow-up. This appeared to be especially relevant for people over 65 years of age. Walking speed did not seem to make much difference. And that's the health news from the People's Pharmacy this week.
Welcome to the People's Pharmacy. I'm Terry Graydon. I'm a medical anthropologist.
And I'm Joe Graydon. I'm a pharmacologist. Today, our lines are open for your calls and questions. We're talking about transforming relationships between humans and animals.
We are pleased to have a special guest here in the studio. Dr. Chuck Miller is the owner of Triangle Veterinary Hospital in Durham, North Carolina. He's been taking care of companion animals in this area for over 30 years. And a disclosure, he's been our veterinarian for decades. Welcome to the People's Pharmacy, Dr. Miller.
Thank you, Terry. Thank you, Joe.
It's wonderful to have you here in the studio, and our lines are open for your stories, comments, and questions. Our number, 888-472-3366. Has a pet made a difference in your life, for your health, for example, or for someone you know? You can email us, radio@peoplespharmacy.com. When you do that, let us know where you're contacting us from. Again, you can also reach us through Facebook. We're at People's Pharmacy. That phone number, 888-472-3366.
Dr. Miller, how does interacting with animals, especially dogs or cats, affect human health?
Oh, in many ways. You can't talk to a person who hasn't seen an animal in a movie, and if the animal is hurt or dies, not many of us can resist crying. It's the emotional bond that we have with animals. It's so powerful. It's hard to put into words. And them. Us, so not only are we emotionally attached to them, they're emotionally attached to us. It gives us a sense of responsibility. We know of the neurochemicals that are released, from us being around them: oxytocin, prolactin, dopamine, endorphins, like the runner's high type things.
Well, Dr. Miller, it's interesting that, people always think, oh, yes, you're a dog person. Oh, you're a cat person. But we also have special relationships with horses.
And rabbits?
Yes, and I've had both. I've owned horses and rabbits, and the bond is just as powerful as with dogs and cats. I mean, remember the movie My Octopus Teacher?
Oh, my goodness.
And who didn't cry in that? And the bond that he had with the octopus, it's just, yes.
It's extraordinary.
It is.
And in fact, I changed my diet dramatically after watching that movie.
I'm glad to hear it.
888-472-3366 is the number to call if you'd like to join the conversation and share your relationship with animals. And again, you can email us, radio@peoplespharmacy.com. Let us know where you're contacting us from.
And I'd like to just quickly ask you about emotional support animals. We hear, I think dogs are the most common, but certainly, as you point out, people can have emotional bonds with all sorts of animals. What distinguishes an emotional support animal from an ordinary pet?
So Usually when we have people that are get permits to have animals with them as emotional support animals, like in an airport or going into a store or living in an area that doesn't allow animals, usually they see a licensed healthcare practitioner, a psychologist, psychiatrist, therapist that assesses that person and deems them, that they are in need of some emotional support, and usually that's in the form of an animal, and then they get a permit to have that. And I had a frog one time that I was very, very close to. The frog recognized me. I was emotionally
come
attached.
on.
He did. I would walk in. He was a white tree frog from Africa, and when I would walk in, he would come over and chirp to me. Maybe it's because I fed him, but my wife, he didn't respond to her, but I thought it was because he liked me more. But it can be a fish, a snake. You guys have seen our big snake, our big python at the clinic. It could be any animal.
Well, I am not one of those people who really gets super anxious when I fly, but there are people who do.
Yes.
And having an animal with them makes a huge difference.
Oh, I think, and I'm not afraid to fly, but boy, I sure like to see a dog lying in the aisle when I'm on an airplane that's there for someone. It makes me calm.
Well, we have occasionally encountered dogs in the airport whose job it is to just circulate in the airport. They're not flying. They're there almost like therapy animals to help people calm down before they're
Well, I'll be honest, I hate hanging out in airports, but because I'm a little wound, I like to be there an hour ahead of time. And that's especially if there's a connection. You have to fly to Dallas to get to who knows where. And when somebody walks by with the dog, and it's, an official, and you can actually pet the dog, you can interact with the dog, and you can communicate.
These are not dogs that are searching your luggage.
Yes,
These are different dogs.
They can be a little scary, but it's so reassuring because airports can be kind of worrisome.
Sure.
888-472-3366 is our number, and we go to Daniel in Vermilion, South Dakota. Daniel, tell us your story.
Hi, hello. My name's Daniel. My family had dogs for as long as we can remember, mainly just adopting or not adopting, but fostering, so that way they can get adopted into good homes. My mom ended up founding this thing called the Rhodesian Ridgeback Rescue, and she's an amazing human being. We had this dog named Tia. She lived for about 13 years, and she was hit by a car when she was maybe about a year and a half, 2 years old, and it really screwed her up. But my mom really, really helped Tia, and she eventually just passed out a year or so ago. She ended up getting some 9 fatty tumors that, with old age, with her Ridgeback, it happened. And about 9 months ago, we ended up getting a new Ridgeback, and her name is Ruby. And Ridgebacks are very, very attracted to personality and, with someone. And I never got that with Tia, but I'm really getting that with Ruby. So you guys talked about how animals affect emotions and people. I never really fully understood that until I've had Ruby, because Ruby is just the best dog ever, man. And I just got done with a week-long at Camp Gilbert. I'm kind of crying because the story this morning about you guys really made me miss my dog. And I'm really excited to go home here. And I'm glad that everybody else kind of feels the same way about dogs, because I never really got it until I got it,
Mm-hmm.
Yeah, for sure.
Tell us a little bit about that. The idea of getting it, because there are some people who are cat people.
Yeah.
And they have a relationship with cats that's very special. And then other people are dog people. And then there's people like you who like frogs. And but when they get it, they get it.
They do. And Obviously animals don't live as long as us. So, somebody my age or your guys' age have had multiple animals, and they're all different, just like people are all different. And some of us are lucky enough, like Daniel, to have this Rhodesian Ridgeback that he is incredibly bonded to, that he loved his other one, but he wasn't as bonded to her. And it's hard to say why that is, but I don't question it, and neither should he. You just embrace it and feel lucky that you have that relationship with her.
And
888-472-3366 is the number, Terry.
And in Dallas, Texas, we're talking to Ron. Hi, Ron.
Good morning. This is Ron in Dallas, Texas. I wanted to ask the good doctor, I'm 77 years old, and I have 2 emotional support cats. And with the corporations owning the veterinarians now, I'm not going to be able to keep them. I'll have to euthanize them because the cost of vet care is $200 a visit and overnight stays $1,000. So what do elderly people do about giving up their emotional support animals?
So that's a heartbreaking story, Ron. And yes, veterinary medicine is getting more expensive. I would encourage you to seek out some alternatives other than euthanasia for those cats. There are organizations that can take them, place them in another home, even organizations that may be able to help you with some of the expenses that you're incurring, taking care of them. Your family, friends may be able to help you. I know some people that do these online, GoFundMe type things to help take care of the medical expenses for animals. And I know it's heartbreaking for you to, have to think about losing them. My heart's broken for you as well. But, try and seek out some alternatives. I wouldn't just go to euthanasia as the first option.
Terry, shall we go to Deborah in Clearwater, Florida?
Yes. And then we will need to go to a break.
Yes.
Deborah, welcome to the People's Pharmacy.
Deborah, we just have a few seconds.
Well, then briefly, I would love to be able to get the message to more people to ask more questions before you take a pet on a flight. I had an extremely traumatic experience flying with my cat recently.
Okay, well, we are going to have to take a break, but if
can
you'll
you
hold, we'll talk to you after the break. We're talking about how animals have affected you or someone you know in a profound way. You can ask a question of our veterinarian, Dr. Chuck Miller. He's standing by. Our lines are open at 888-472-3366. If the lines are full, you can email us, radio@peoplespharmacy.com.
You're listening to the People's Pharmacy with Joe and Terry Graydon. Welcome back to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. The People's Pharmacy is brought to you in part by Sonu, an FDA-cleared, drug-free treatment for nasal congestion and runny nose, a sound-based alternative to steroids. More at getsonu.com. That's getsonu.com.
Today, we're talking about how animals affect our health with Dr. Chuck Miller of Triangle Veterinary Hospital in Durham, North Carolina. In fact, we're talking about the entire relationship between humans and animals. Dr. Miller's website is trianglevet.com.
And we invite you to ask a question or share your stories. The number is 888-472-3366. You can email us, radio@peoplespharmacy.com. Our Facebook is at People's Pharmacy.
And we go back to our call with Deborah in Clearwater. Deborah, tell us about the experience you had taking your cat with you.
I'm encouraging people to ask more questions about cats traveling. Even though the airline says they don't need a medical statement, it was time for my cat's shots. I took him in. The vet said, "Okay, great. He'll be fine for the trip." And I picked up some food that I would need for our arrival. During the flight, the people next to me said, "Your cat's going to scream through the whole flight." And I didn't have any clue prior to that moment that there would be any kind of issue. Well, when we got to Tennessee, we had to go up over a storm cloud and back down again. On the way up, my poor cat screamed his head off. He's 6 years old. He's not a wimp, but he screamed. It broke my heart. And his eyes bulged out. His mouth was up wide open, and he bit me really hard. Now, we made up after that. He licked my hand, but it took us some moments after arriving way up over the clouds, and then it happened again on the way back down. So these things are things to be dealt with somehow or another. Perhaps your vet doctor can explain something that I should have done, but my vet didn't say anything, the airlines didn't say anything, and the pet store that I bought the calmative herbal concoction from didn't say anything about the weather and the potential trauma. It was extremely psychologically devastating.
Thank you for sharing that story, Deborah. Dr. Miller.
Yes, Deborah, I'm sorry you had that experience. And unfortunately, airline flights we don't take them every day. And, cats don't typically spend a lot of time on airplanes. There are a few things that you might think about doing in the future. So one might be to try and condition your cat to traveling. So, pick your cat up, put it in a carrier, put it in the car, drive around the block, come back home, give it a treat. Do that several times. You can do it in different weather, like you mentioned the weather. So maybe try taking it out, him or her out in the car during a thunderstorm, or, when there's loud noises or things like that. If you see that the cat is abnormally stressed, and it sounds like it really was, and it didn't bite you out of anger, it just bit you out of fear, I'm sure. We have some fairly safe medicines like gabapentin is a drug, Neurontin is a drug that works really well in cats, for cats in stressful situations. We have several of our patients that we have them administer gabapentin to them 30 minutes before they come in for a veterinary visit to get their vaccines. And it works really, really well. So you might want to ask your veterinarian to do a trial of that. I would encourage you to do a trial at home before you travel with the cat, just to make sure that the cat doesn't have any side effects from the drug that you would like to be aware of before you tried it.
Dr. Miller, there are a lot of people who live alone.
Mm-hmm.
And having an animal can make such a big difference. I'm sure you have seen a number of situations of that nature. Can you describe why that bond is so helpful for someone who does not have a human companion?
Yes, I mean, and it does. And I live alone, and my dog is. Several people listening may have already met my dog. He's at work with me every day. It gives you a sense of responsibility. You need to take care of them. They can't take care of themselves. It helps you bond with them. When
it also encourages you to exercise.
Absolutely. And a lot of people that live alone are older and need to exercise. And it's easy to, if you don't have a reason to get up off the couch and go outside, you just find yourself
magic
doing
is not going to take no for an answer.
Magic is not
He has to
taking
go out, right?
He sure does, and it does. It makes us want to get up and go for walks with him, and then he enjoys the interaction with the people in the neighborhood that see
I'm
him.
sure everybody loves him.
They do.
We have a question from Dorothy in Sun City Center, Florida. Dorothy, what's your question, please?
I would like to have him make a distinction between the comfort dog and a service dog. Now, is a service dog allowed to be petted by somebody other than the owner of the dog, or is it can people pet either comfort and service dogs that belong to others?
What a great question about the relationship between humans and animals, humans and dogs that are there for a purpose.
Because everybody wants to pet a beautiful, friendly,
And
wagging dog.
and service dogs,
Well,
you're not supposed to.
Yeah, exactly. Tell
So,
us.
Dr. Miller.
Yes, so service dogs and emotional support dogs or animals, service dogs, emotional support animals are different. Service dogs are dogs that are specially trained. They go through a long training process that not all make it through. Some aren't able to be service dogs to help people that are blind, say, or people that have seizures that can detect when people or before they're going to have a seizure, or diabetics before their blood sugars drop so low. So you're correct in that you wouldn't want to just walk up to one and pet it. It is okay, though, to ask the person who has that service dog, would it be okay if I pet your dog? And if they say no, then don't. But if they say yes, then you can. Emotional support animals don't go through that. There's no training required to be an emotional support animal. But I would still encourage any time that you approach an animal and you'd like to pet it, ask the owner or the person that's taking care of the animal if it's okay to pet them.
We're talking about animals and how they affect our health with Dr. Chuck Miller of Triangle Veterinary Hospital in Durham, North Carolina. We invite you to join the conversation. Our number is 888-472-3366. You can email us. We're at radio@peoplespharmacy.com. Please tell us where you're from. Again, if you'd like to email us your question or your comment, radio@peoplespharmacy.com. Oh, and you can also reach us through Facebook. We're at People's Pharmacy.
And we go to the phones. Danny in Greensboro. Welcome to the People's Pharmacy.
Hola. I wanted to bring up another aspect of pets and health, at least as it relates to or regards to non-traditional pets. And so my familia would go down to Mexico to visit our familia in Mexico. My brothers and I, cousins and stuff, while visiting, we would befriend traditional pets like lamb and deer, and we would completely fall in love with these pets. And it was always difficult because a lot of the times those pets were used as food. So my parents are always, just be careful when you fall in love with sort of those non-traditional pets. And I remember many times, we have photos and stuff of just falling in love with these goats and deer and lamb. And then, it's time for dinner. What are we having for dinner? Well, what did you name that goat? Billy. Well, we're having Billy the goat for dinner. And it was always painful, so delicious.
Yes, this is actually a problem that's not unique to Mexico. We hear from farm families that you have to be careful about your relationship with the animals that you are planning to use for food.
That is true, and I'm guilty as charged. You can't be around a cow or, as you say, sheep, goats without falling in love with them. Chickens, people that take care of chickens or the turkeys and take them out the day before Thanksgiving and prepare them to eat on Thanksgiving dinner. It's hard, and it's hard not to become attached to them. I don't have a good answer as to how you can prevent yourself from doing that. If you want to interact with animals, it's hard not to attach to them.
Well, I've probably told this story before, and so I apologize. But, I grew up on a dairy farm when I was very young, and my Uncle Leo had about, I'd say, 50 dairy cows, and occasionally he would sell a calf. And this one day,
because you want the milk,
right,
and you don't want the calf to compete for that, right?
That's right.
So he sold the calf. Well, the mama calf would not stop crying. And she cried not for a day, not for 2 days, but for a week. Every day she would cry and wanted to know where her calf was. Uncle Leo tracked down that calf and brought her home.
Good.
And that was one very happy cow. And every cow that he had a name. And he had a very special relationship with all of his animals. So just wanted to share that story.
And luckily, dairy cows are not dinner most of the time.
Right.
That's right. And Terry brought up a good point. With dairy cows, milk is the commodity.
Yeah.
We take the babies immediately off the moms and feed them with bottles so that mom can make the milk.
Now, I do have one question before we go back to the phones. This is an email question, and it comes from someone who says, what about dogs that have itch problems? This person has a German Shepherd, and she keeps scratching at those sores. Any suggestions? And if you have a question for Dr. Miller, you can also email us. Remember, that email address is radio@peoplespharmacy.com. So what about scratching?
Yes, so skin problems are one of the most common problems that we see in veterinary medicine. And because we have such great flea and tick preventions now, it's usually not a flea allergic or flea-induced type dermatitis, although that still is a potential, and other parasites as well, other than fleas, like mites, can cause that. But overwhelmingly, the most common cause is allergies. And we see three things that cause allergies. The three most common things are parasites like fleas, foods, usually it's proteins in the foods, not the carbohydrates in the foods, and then environmental allergens like pollens, grasses, weeds, and things like that. So I would encourage you to see your veterinarian about that itching. They'll be able to assess your dog and then offer a treatment.
Speaking of food, we see commercials on television now that advertise, this is really great food for your dog. And anybody who's feeding their dog other food,
something else.
Yeah, but shame on them. And, this food goes in the refrigerator. It's just like human food. What's
the deal
best?
on dog food?
So the deal on dog food is there's a lot of great dog foods out there. And this is marketing. Hype a lot, to sell a product. So you're going to market your food for that, that it's going to be the best thing since sliced bread, if you will. No pun. So as long as an animal is getting, and there are regulatory agencies that will certify foods as adequate nutrition. Purina, the largest food producing, the largest food company in the world, they make foods for zoo animals. They make foods for animals in parks in South Africa. They're veterinary researched, and they're great. They're perfectly fine.
So you don't have to spend a bundle.
No, and I would encourage people. That's right, and I would encourage people to not buy into the grain-free thing. That people. A lot of people think they have celiac disease, but they really don't. Dogs, correct me if I'm wrong, you could fact check me, but I think there's only been like one family of Irish setters that actually were diagnosed with celiac disease. The problems aren't carbohydrates in the diets, they're the proteins in the diet. So ask your veterinarian what the best food would be for them.
And if the dog is having skin allergy problems, itchies, and then changing the food can often help, right?
It can, and the two ways to do that would be to try and choose a novel protein in the diet, something that they've never been exposed to, or use a hydrolyzed protein diet, and there are Hills makes one, Royal Canin makes one, Purina makes one. I think even Blue Buffalo may now make one.
We've got an email from Shelley in Wilmington, North Carolina. She's the mother of 3 pets. Her 2-year-old Chihuahua provides comfort. Her 20-year-old parrot provides humor. And her newly adopted tree frog is rehabbing it in the wild and belongs in the wild, but they all provide her with love.
Shelley, you're my kind of person.
We have just a minute before the break, Terry.
Okay, well, I don't know if Sam can tell us his story that quickly. Can you, Sam, in Raleigh?
I think pretty quickly, yes. When I was about 11 years old, I was staying with an uncle on his farm, and I was allowed to ride the horse. And her name was Lady. And one day we came back, and I stopped and got an apple and gave it to her. And I was standing right in front of her. I was barefooted, and she put her foot right on top of mine. And I remember looking up at her and saying, "Lady, will you please take your foot off of mine?" And she did.
Oh,
yes.
That's a wonderful story.
A great story.
We are talking about pet-human relationships today on the People's Pharmacy. We're coming up on a break. We're talking with Dr. Chuck Miller.
And we welcome your stories and questions about animals and our relationships with them. Our lines are open at 888-472-3366. You can also reach us through Facebook. We're at People's Pharmacy, or send us email, radio@peoplespharmacy.com.
We'd like to hear your story. Tell us about your relationship with animals, whether it's a tree frog or whether it's a fish or whether it's a cat or a dog or a horse. You can join the conversation. Again, that number is 888-472-3366, and the email address, radio@peoplespharmacy.com. In the next segment, we're going to talk about a really challenging topic, and that's what happens when your dog or cat is no longer enjoying life. How do you decide the end is near? So join the conversation, 888-472-3366.
You're listening to the People's Pharmacy with Joe and Terry Graydon.
Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is brought to you in part by Sonu, an FDA-cleared drug-free treatment for nasal congestion and runny nose. A sound-based alternative to steroids. More at getsonu.com. That's getsonu.com.
Today we're talking about transformative relationships between humans and animals. Here to answer your questions and hear your stories is Dr. Chuck Miller of Triangle Veterinary Hospital in Durham, North Carolina.
Our lines are open for you at 888-472-3366. You can also reach us through Facebook. We're at People's Pharmacy, or email radio@peoplespharmacy.com.
We got a sad story this week from a dear friend of ours. We've known Brian for how long, Terry? Over 50 years?
Yeah.
Yeah. We went to graduate school with Brian at University of Michigan. And here's the message that we got from Brian this week. Sad day at Casa Weiss. Abby was euthanized this afternoon, fulfilling a commitment of ours that we would always put her needs and comfort first. She passed completely peacefully on our front portal at 2:45, beneath cloudless skies with a soft breeze blowing through her fur. Abby liked, well, everything. People, new places, new smells, new treats, old treats, people licking out the yogurt cup, and especially people. She was loyal to us, but welcoming to everyone. Her tail was always ready to wag. She made the world, and especially our world, a better place.
Dr. Miller, how do you know when it's the right time to say goodbye to a beloved animal friend?
So this is a very difficult part of my job, and unfortunately, it's not a one size fits all. And we are usually tasked with the responsibility of putting an animal down. They don't usually die by natural causes on their own. You know, some do. You'll wake up and
I've
find
had
them.
2 dogs who did, but
Yeah,
yes, you're
it's
right.
very uncommon. So we are tasked with that. And the way I approach this with my clients is, you know, we're humans and we're social. My friend Tina DeShays always, you know, tells me about how we're meant to be social creatures, and animals are social creatures too. So we live through life and we go through ups and downs, and our animals are always there for us. You can come home and sit on the couch and you're depressed, and your dog comes up or your cat comes up and lays on your lap, and they take care of us when we need to be taken care of. And then the flip side of that is that when they need to be taken care of, whether that be to make an end of life decision, they need to be taken care of, and we owe it to them to do that. So then we find ourselves in this quality of life quandary. And it depends on what, you know, the animal does. If this is an animal that just really doesn't do much, you know, they're not out playing, chasing a ball or something, it may just, their quality of life may just be, you know, eating, drinking, you know, having their pain control, not being able to take care of themselves and keep themselves clean. If it's a border collie that lives on a farm, spends its whole life, herding sheep, and it hurts its leg and can't do that anymore, that quality of life may be different than the one that just lives inside. So you just have to, you know, ask yourself what makes life worth living. And when life is not worth living anymore, it's better to not go on living.
And you have to try to take that from the animal's perspective.
That's right.
There's another question. What happens when a person dies? That can be hard for an animal. There's a couple of movies. You were sharing a little bit about one in Japan. We've seen a movie recently called The Friend with Bill Murray about a Great Dane who outlived the master. Tell us a little bit about that Japanese story.
Oh yeah, that was the movie Hachi, and this is a true story where this dog would wait for its owner. The owner would walk to a train station to go to work from his house, and the dog would go with him, and the dog would meet him when he returned on the train every day, and then walk home with him. And one day the owner didn't come home. He died, and the dog grieved horribly and would not leave that train station. And so the people in the city started taking care of the dog, and finally when the dog passed, a statue was erected of that dog in the center of the town. Animals grieve horribly when their owners die. Look, people that take dogs to shelters. Okay, I've had a dog for 10 years. I met this person. They don't want animals, so I take it to the shelter. Oh my gosh, it's heartbreaking for these animals to be separated from their owners. So I think that people need to have a plan in place. Should they die, put them in their wills, leave money in their will so that the animals can be taken care of. Have a plan there should something bad happen. But yes, they are heartbroken.
Actually, the story, the movie that Joe mentioned, The Friend, the dog was definitely grieving, having survived its owner. We have an email from Natalie in Denton, Texas, which is a story about you, Dr. Miller. In 2021, during COVID times of pet drive-through checkups, My parents had to make the decision to euthanize our sweet old dog. It was very difficult for them, and I could not be there, and neither could my sister. However, my parents were so thankful for the time Dr. Miller took to sit in the back of the SUV to pet him and soothe Cooper, telling him what a good boy he was. Thank you for your empathy and tenderness. So,
Thank you, Dr. Miller.
Thank you, Natalie, for the kind words.
now we have a call from Denton, Texas. If I can go to the call. Sharon, in Denton, Texas, you say you've got a different experience on taking a cat on a plane. Please let us know.
Yes, I do. A little preface to that. This cat was the best traveled cat. He went cross country with us in the car from Texas to Washington every summer, and then spent a month on the sailboat with us. But I took him on a plane once, and I would never do it again because he had chronic ear infection, and it was the altitude change that hurt his ears. But our vet,
Sharon, I'm sorry. We have a very bad connection, so we are having a little difficulty hearing you.
But we did hear you say that the altitude change could really be very painful for the cat, especially if it had an ear infection.
And, you know, I have to tell you, I know what that feels like. I mean, I can't tell you what the cat was experiencing, but I have experienced excruciating pain, especially when the plane is coming down. And I suspect there are many other people who do. And if I was a cat, I'd be screaming.
We've got a question from Don in Albany, Ohio. Don, go ahead, please.
Hello.
Your question.
Hello. Yes. What is his thought about people having pit bulls, given the regular, there's news stories on a regular basis of them killing people, severely maiming people. What does he think? Is that a good idea to have such an animal as a pet?
Probably not a good idea to have an animal that would kill a person, but I don't know. Dr. Miller, what do you think about just making a blanket decision based on breed?
Yes, so you are correct in that if you were to Google the most animal bites or dog bites are, pit bulls are overrepresented. But in my overwhelming experience with pit bulls, they're some of the nicest dogs I've ever taken care of. And, all dogs are different. I mean, a Chihuahua may bite you. Pit bulls are just big and strong. So if they were to bite you, they could really harm you. But some of my greatest patients are pit bull patients. So I wouldn't use that as a blanket.
I've got an email from Sherry in West Virginia. Rescue pets. Many rescue organizations are seeking foster homes for animals. It's a great way to experience the love and connection from a pet without the long-term commitment. So, rescue organizations.
Yes, and we are really, really lucky to have some wonderful rescue organizations. In Durham, we have some excellent ones. And, the option of taking a dog to a shelter and having them euthanized versus placed in a foster home where they can be taken care of in a family setting, and then sometimes adopted out to the right people. Sometimes we call them fail fosters because they're so wonderful. The people that foster them could never give them up.
They say, "Okay, this is my dog now."
That's right, and that happens more often than not. But so yes, I think that's a wonderful that's a wonderful way to find an animal, and then you can go visit the animal and see them in their home, and they can bring them to your house and see where they're going to live. Yes, I think that's great.
We're going back to the phones. We want to talk to Parker in Scottsville, Virginia. Parker, tell us your story, please.
Good morning. Thank you, Dr. Miller, for what you do. My wife and I have a 10-year-old Bernese Mountain Dog. We waited later in our life to get her because our schedules we traveled a lot for work and we just couldn't have that. But when we got that dog, we said, we're going to give this dog the best life we can give her. And we have tried our best to do that. But that dog has given us our best life. It's taught us to go out into the snow and long walks. It's been good for our health. It's been good for our mental health as well as physical health. And when we mention, do you get it? It's obvious the people on this phone and on the show, they get it. Your callers get it. They love their animals. But it's not always that way. Living here in rural Virginia, I see dogs in cages outside in the sun. I see people that treat their dogs not like living beings. And so really, I don't have a question for the three of you. It's really for whoever is listening, that these animals are living beings that need us. And they'll be loyal to us no matter how you treat them. But you should treat them well. They're living beings that need us. And folks like Dr. Miller, I appreciate what you do for these animals in your caring. Thank you.
Thank you, Parker.
Thank you, Parker. That is, yes, I feel the very same way. I've seen things that would just break your heart. So thank you.
Dr. Miller, we do have a question that came in on Facebook that's related to a question we took earlier. Catherine in Ithaca, New York, wants to know, how do you pick a puppy or a dog to rescue? She says, I seem to keep picking dogs with behavioral issues like high anxiety or lots of barking at other dogs. So how do you choose a dog that's going to be compatible?
So that's a great question, and we deal with this a lot too. A lot of animals that end up in a rescue because they have problems and the people can't deal with them. So I would encourage you first to, when you're evaluating, interviewing a dog or the rescue organization for adoption, ask about the dog's history. Find out why they were, surrendered to a rescue organization. That'd be the first thing. The second thing is, okay, if this is a border collie that's in a rescue, realize that the breed needs a lot of exercise. They need a lot of things to do. It's not going to be like a golden retriever.
They're busy dogs.
They're busy dogs. So if that's not going to work with you, then that might not be the dog for you. So ask the questions, get a history, and then look at the breed of the dog, and then spend some time with it, before you adopt it.
We got an email from Timothy in Raleigh, North Carolina, regarding dog food and health. He says, we used to feed our dogs our leftovers. Now, for our human health, we have changed our diet. Is today's dog food too processed? What about table scraps?
Yeah, so do what I say, not what I do. So we're not really, it's sometimes bad to feed dogs table scraps, particularly high-fat table scraps. Dogs, if they eat a diet too high in fat, can get really bad GI disturbances, acute pancreatitis, which could be a life-threatening thing. So, yes, I would probably stay away from the table scraps. Do I occasionally do it on mine? Yeah, okay. Guilty. But as far as the processing of foods, the regulatory agencies that actually qualify these foods as nutritionally adequate do a pretty good job with that. But if you buy a food that is certified, then they should be fine.
One quick last question, because we are running out of time. Overweight dogs. We see a lot of, well, not just dogs, cats and lots of other creatures.
Along with their humans.
Indeed. How do we restrain ourselves from giving our favorite animals too much?
It's hard. So one thing I would say with dogs, first of all, there are some metabolic conditions that can cause dogs to be overweight. So it's not always about the food. So I would see a veterinarian, and they may want to check their thyroid. They may want to check some blood work if a dog were to have, say, Cushing's
And that's also
disease.
true for cats.
Yeah, and cats as well.
And humans, I might add.
And humans. And then if you rule out the the medical causes that can cause them to be overweight, then you would want to talk to your veterinarian about putting them on a diet and then establishing an exercise routine. And that oftentimes we see animals that are heavier, their owners are a little heavy too, and the exercise can help the owner and the dog. They'll be much healthier at a low weight, but from things like osteoarthritis, it'll be easier on them if they're in pain. So.
Well, that's all the time we have. Thank you so much for listening and for sharing your stories.
The People's Pharmacy is a co-production of North Carolina Public Radio, WUNC, with the People's Pharmacy.
Lynn Siegel produced today's show. Pamela Eberl, Alberta, and Ayasi Chinflu provided technical assistance. Al Wadarski engineered. The People's Pharmacy theme music is by B.J. Liederman.
Thanks to today's guest, Dr. Chuck Miller. He is the owner of Triangle Veterinary Hospital in Durham, North Carolina.
The People's Pharmacy is brought to you in part by Sonu, an FDA-cleared, drug-free treatment for nasal congestion and runny nose, a sound-based alternative to steroids. More at getsonu.com. That's getsonu.com.
Today's show is number 1435. You can find it online at peoplespharmacy.com. You can subscribe to our podcast through your favorite podcast provider. We post the show on our website on Monday morning. That's where you can share your thoughts about this show and share additional stories about your interactions with animals. You can also email us your comments, radio@peoplespharmacy.com.
If you go to peoplespharmacy.com, you can sign up for our free online newsletter. It's an easy way to stay on top of the breaking health news. By subscribing to our newsletter, you'll also have regular access to our weekly podcast and find out ahead of time what topics we'll be covering. Speaking of the podcast, we would be so grateful if you would consider writing a review of the People's Pharmacy and posting it to the podcast platform you prefer. In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thanks for listening. Please join us next week. Thank you for listening to the People's Pharmacy Podcast. It's an honor and a pleasure to bring you our award-winning program week in and week out. But producing and distributing this show as a free podcast takes time and costs money.
If you like what we do and you'd like to help us continue to produce high-quality, independent healthcare journalism, please consider chipping in.
All you have to do is go to peoplespharmacy.com/donate.
Whether it's just one time or a monthly donation, you can be part of the team that makes this show possible. Thank you for your continued loyalty and support. We couldn't make our show without you.